to the Turd Nerds, the functional gastroenterology podcast where we talk about all things poop. We are your hosts, Dr. Rebecca Sand. I'm a naturopathic physician specializing in gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine.
And I'm Dr. Alana Gurvich, a naturopathic physician board certified in naturopathic gastroenterology.
Before we take the plunge into today's episode, we would love to have you check out our new website, turdnerdspod.com, and check us out on YouTube. Links in the bio.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Welcome back, Turd Nerds. You might be noticing that our audio sounds amazing because we finally took, our podcast started in Rebecca Sand's closet. We moved into her bedroom for like a second.
Yep.
Now we're in the office. Now we're in the office with mics in front of our faces.
Look at this.
It's amazing.
It's amazing. Yeah. Shout out to the amazing Paul Kim. He guided us on figuring out good audio equipment that we could afford.
So you don't want to turn us off the minute you turn us on.
I know. I feel so fancy. And those of us joining us on YouTube, now we're on YouTube and you get to see all of this. So, and our lovely faces. You guys look amazing today.
Woo.
Well, you said we had to go on video. So
I did.
Take it to a whole different level.
Amazing. Yeah.
So today, what we're going to talk about is something that comes into the clinic all of the time.
Yeah, it's super hard to treat.
It's super hard to treat. And just like, I think every patient, every second patient, Dr. Sand is going to jump into a crazy good deep dive about bloating.
Yeah. So we've talked about bloating a whole lot on this podcast.
Because it affects
Not
everybody.
as much as constipation.
Yeah.
Because it also affects everybody.
I mean, constipation makes you bloated.
It does.
True. That's a good
So,
point.
I mean, as it turns out, our tube is all connected. Everything else. So bloating, I think, is a really important one to talk about. We all get a lot of patients that are bloated. And of course, if we can identify an underlying cause, we treat the underlying cause. And then sometimes we just can't. There is nothing microbiome or identifiable, that we need to treat. And people are just bloated and uncomfortable.
Yep.
And these are usually the folks that'll come in and say, I look pregnant. I look pregnant after drinking water. I look pregnant after eating certain foods by the end of the day. When I go to restaurants, whatever. So when I look at bloating for people, I'm trying to kind of like chunk it out. And I do have my notes here today. But I try to chunk it out in like why. If we can parse apart why they're bloated, because that can sort of guide treatment. In the same way with the constipation episodes, like why are they constipated? Yeah. Where exactly precisely is this becoming a problem for people? So I have 1, 2, 3, 4, 5, 6, 7 different camps of bloating that I look at.
Okay.
Wait, should we try to guess first?
Ooh, yeah.
I would think if they're constipated, that would be one of the big ones.
Yep.
Is that in one of the categories?
Poor motility is.
Okay.
I would say mast cell, like histamine issues.
Histamine is one. Yep. You got 2.
All right. I mean, dysbiosis.
Yep.
Fermentation.
Yep. Microbiome problems. Yep.
Nervous system. I don't know if that's in your list.
Differential.
I think it goes through a bunch of these. It's not specifically.
Like vagus nerve dysfunction, stuff like that.
Yeah, I would probably put that in motility.
Okay.
And then food allergies, food intolerances.
That's a great one. That's a great one.
And
kind of along the histamine line.
Yeah. And then IBS, SIBO.
Yeah.
Or just like...
microbiome.
Or visceral hypersensitivity.
Ooh, I like that one too. I mean, probably these could all be chunked into different categories, but like different umbrella terms.
Yeah.
What are the categories you came up with?
Let me list them out.
Okay.
Let me list them out, and then we'll go into each one sort of as we need to and discuss what we do about it. But first one, gas in. We're putting gas in.
Yes. Gas
Carbonated
in.
water.
The second one, gas can't get out.
Yes.
Third one, histamine issues.
Yes.
Fourth one, microbiome issues. Fifth one, inflammatory or maldigestion.
Yeah, for sure.
Sixth one, poor motility. And then seventh one that I see often missed is structural.
Oh, yes.
Yeah.
So that's where I kind of chunk them, and everything that you just said fits into those in one way or another. I think another great one would be like gut-brain axis stuff, but that,
I would
does
put that. I
not
think
fit.
motility is a good place for that.
Yeah.
I mean, the structural, I will say that is the one that I always forget about until I've exhausted the other ones. And then I'm like, oh, maybe it's a structural issue.
Yeah, I mean, I think I see it all the time because I work with so many folks with endometriosis who have
adhesions.
Yeah, or I have a lot of hypermobile folks who have like ligament intestinal,
Laxity.
sagging and laxity. So for me, it's like very present, but it's also common with people with MCAS and histamine issues and a lot of crossover.
Yeah.
And when I'm looking at bloating or frankly constipation for people, I'm looking at this sort of pie chart of like, probably it's a multifaceted thing. Probably you have a little bit of microbiome, you have a little
Right.
bit of inflammation, because they all go together. But like, to what degree are we going to get traction treating the structural or the microbiome or the digestive issues of any variety?
Yep.
So I try to do everything. If I'm suspicious of there being adhesions, we go that angle. If there's a microbiome, we go that, like, we all do this, but that's sort of my lens I'm looking through with these peskier symptoms. So let's talk about gas in.
Okay.
What does that make you think of?
Carbonated drinks.
Yep.
Yeah, I feel like a lot of people are drinking a lot of carbonated
I
drinks.
feel like a lot of people are drinking carbonated drinks instead of water, assuming it's hydration.
Well,
but
I'm
it's
trying
not.
to get them off of soda and such. So then I say to get the carbonated water,
Right.
but maybe
I mean, it's a step. It's
Yeah.
a step. But you're
Yeah.
putting gas in.
Yeah.
You're weakening that lower esophageal sphincter over time, which happens as we age.
yeah,
Anyway.
I will
increasing
tell
GERD
you,
probably.
Yeah.
the gas in, like, people don't want to give up their, and we're working with different populations. Like,
You don't drink a lot of carbonated water, I noticed.
no,
You don't
I don't like it as much.
Oh, really?
But here's
That's
the thing:
great.
when I have patients come in, they have gotten off the soda,
Right.
and they have gotten to the bubbly water, and
Yeah.
they're like, "I'm doing something good drinking
Yeah,
bubbly
I
water."
No, but most of our
I know.
cans are full of chemicals.
and plastics.
Yep. They're
I mean, you
awful.
can get it in a glass bottle, but it still has...
Even
it still
those,
has-
some of them have linings.
Really?
Yep.
I
I don't want to
Weird.
name brands, but there's some brands.
I mean,
yeah.
anybody can do a Google search.
Yeah,
Almost all of
Environmental
them.
Working Group posts about it.
That's
Yes.
weird. On glass bottles?
Yep.
Oh, on glass bottles?
Yep.
The glass bottles have linings?
Yep. Some of them.
Wow,
There are
wow,
chemicals in there
wow.
that are on the list of
Huh.
endocrine disruptors.
Weird.
Not all of them, just some are better than others.
I feel like people are drinking more bubbly water than they're
Yep.
drinking water. And
Yeah.
for me, it makes me more thirsty. It dehydrates me.
Oh, really?
Yeah.
Weird.
I
Do you
think it
drink bubbly
settles
water?
my stomach.
I mean, I want to, but I don't, like, I can't, me and my husband have no self-control, so we'll buy it, but then it'll be gone in like a day, and then we're like, okay, we won't buy it
That's how
again.
my roommate is. I feel like I moderate it pretty well. Like every once in a while, it helps calm my stomach. It just feels good, but then they're just gone.
It tastes so
in my
good,
fridge.
like the first couple sips.
Yeah.
I
and
feel
then
like
I don't really
some of
need
them
more.
have an off gassy thing
Oh,
that
no.
I don't
I
like
wish
when
they
I
just
open
sold
it.
them in really little cans.
They do
like,
for kids.
They have bubbly
Branding.
water for
Yeah.
kids?
Yeah, they have like unicorns on them and stuff,
Oh my God.
like fairy juice or something like that.
I
They
feel,
taste pretty good.
I feel like I'll go for it, like, because I have a soda stream in my house.
Yeah.
So I'll go for it
Isn't
and then
that
I'll
in
drink
plastic?
it. It's glass. My soda stream is glass. I
No,
I
they
have the
made
pan-
a
Yeah,
glass.
they make a glass. I got rid of
That's
mine.
great.
Yeah.
That's
We weren't
great.
using it.
Yep.
And so then I notice myself being like it quenches my thirst for like a minute, but then I'm more thirsty. So
what
now I
that's
try
about.
to have regular water first and see if I still want it.
Yeah, I mean, always.
Yeah.
Have regular water first and see if you still want whatever
Yeah.
after is like a good rule of thumb.
Yeah.
But gas in,
Yep.
for sure that makes
So
sense.
also, some people have nervous tics where they swallow air. And I
Or
have
if
found
they
that
have-
people don't
yeah.
even know it, but you can observe it. I've definitely seen this with some of my patients.
What does it look like?
They kind of just swallow a lot.
Huh.
And sometimes it's like audible.
I don't know if I've ever seen that. Let me.
Yeah.
I haven't, but I think also with the people who don't have the proper swallowing function, if their tongue is like low lying and stuff, they swallow more air.
Oh, right. Yeah.
Yeah.
Facial structure probably.
Yeah.
Is
plays a
there
role.
anything to do about that? Like the bubbly water is easy. Don't drink
You
bubbly
can
water.
do
I mean,
you can do myofunctional therapy for or speech therapy for your
Yeah.
tongue
Swallow?
position. Yeah, swallowing
I
function.
also think it's an anxious
Could be.
response for some people. So
Yeah.
kind of addressing underlying anxiety. But and then chewing too fast. Not chewing enough. Like, of course, you're going
I
to
mean,
swallow
who
more
has
air.
time to eat lunch?
I mean, not me.
You gotta chew fast.
I don't know. I
got
mean,
like
I
2
tell people
minutes.
this, but do I do it? No.
I am
Probably
pretty
why I'm
good.
bloated
I
all
am
the
pretty
time.
good at eating my breakfast and my lunch.
Slowly?
Yeah.
I mean, not like I'm not shoveling it down. I have built breaks into my schedule to make it work.
You have not built breaks
I have
into
never
really?
once seen you build a.
I've never seen you
I'm
build a
good. I have
break
a 10 or
in.
10:30 break. That's a 30-minute for my breakfast. That's when I eat breakfast.
And
You
you
don't
don't
see
add in a
patients then?
patient?
No. I do not see patients.
You
When
don't
did
add
you start
someone in?
this?
Definitely since I opened up the new clinic.
Okay. You didn't
Yeah.
used to.
No.
I'm floored.
Yeah, no, it's actually made a big difference. Like I cannot. I need breakfast.
Don't say. Yeah, I know. We know this. We
Yeah.
know this. Way to implement it.
Yeah,
I'm proud of you.
Thank you. I mean,
Yeah.
the nice thing about
You
owning,
put in at when? 10?
10 or 10:30.
10 or 10:30.
Well, whatever
I
time works.
have never taken a break. I mean,
Really?
when I was pumping, I had to.
I don't do acupuncture as much anymore.
Yeah, same. I know.
Yeah, so I kind of have to.
I know.
If
We're
I'm gonna
talking all day.
eat.
I know.
Yeah.
I know. Anyway, chew, I guess. Try to at you.
Drink liquid.
Take a lunch break or something. Yeah. Okay, so that's gas in. You're
That's
just putting
genius.
gas in. Think of that. 'Cause that's not going to help matters. Gas out. So, of course, there are going to be some overlap between some of these and others, but I like to tell people we're just a tube. And if there's gas in there, it either was put in, it can't get out, or something is making it.
Yeah.
Like, that's it. That's all we're looking at for gas.
Yep.
So we got to figure out the culprit. So if gas can't get out, what are you thinking of there?
Constipation.
Constipation.
SIBO.
You're clogging the tube.
So gas can't get out. This is what I always tell patients. The stomach, if you have gas, you belch.
Yep.
The large intestine, if you have gas, you fart.
Yep.
In the small intestine,
It
you've got a
gets
valve on
stuck.
the top and a
Yep.
valve on the bottom. It is trapped. You bloat.
Yep. And that's why SIBO is so pesky for people,
Yeah.
because it's manufactured in the small intestine. I mean, that's just they're
Yep.
making their gas. So yeah.
Yeah.
Yep. So all of that, adhesions, of course.
Oh my God,
So
adhesions.
if people have had like an emergency appendectomy or their gallbladder out or whatever, colon out, endometriosis ablation or anything that just created adhesions, pulls on stuff, even if it wasn't directly in the bowels, it's going to pull on how things move in
Yeah.
there. And gas might get trapped. I see this a lot. I'm sure you guys do too with post appendectomy, because
yeah.
that's the ileocecal valve that gets scarring, and then everything builds up in the small bowel. Even if they're not overproducing gas in the small bowel, the little bit that is made in there just can't get out.
Have you guys had patients with appendicitis that were treated with antibiotics
Yes.
instead of surgery?
Yeah.
And according
doing
to the,
that more.
Yeah.
According to the data, it's
Yeah.
actually equal. Have I seen it play? It's equal in efficacy,
Yeah.
as equal to surgery. Have I seen that play out in my practice?
We're not old enough yet.
Well,
to
I'm
see.
going to say
But
no.
my
Really?
question is, how long term are those studies? Because people often will hit it with antibiotics and then have to go back in a year or whatever later.
Is that what you mean when
Well,
you're not seeing it play out?
What
that
I
they
mean
then
by
have to
not
get
seeing
surgery?
it play out is I'll often see people take these long courses of antibiotics.
Oh, really?
Get kind of stable for a short amount of time,
Uh-huh.
and then
Oh, then they
not
need
that far
surgery.
away, they need surgery.
But I wonder if you pair it with microbiome treatment.
I mean, I feel like though, if you're taking if you are giving them that many antibiotics, right,
Yeah.
and it is a longer course of antibiotics.
Yep.
When are you going
It's
to do
gonna cause-
microbiome? Like, it's
yeah.
going to cause microbiome issues
Yeah,
just by the antibiotics.
you're depleting your
Yeah.
system,
and you're
so-
just changing the entire makeup, which is going to change everything.
Yeah, I know. It's not just, I don't know, hang on to your appendix, but
Yeah.
try to treat it well in there. I don't know what to say. I had mine out. It created a bunch of issues for me.
Did you? I had my gallbladder out, and I
Yeah.
don't know how many issues it created. For me.
Don't say that.
Well, I've
Yeah,
got
sorry, good
issues
point.
and I still have all my organs except some of my teeth.
Wow, you have all your organs. Yeah,
Except some of my teeth.
I lost a bunch of those too, so I don't know. Yeah, the appendectomy, I think that's what's made me this so hyper focused on this for people. I just have a ton of, and I'm not like a scar tissue builder. I'm
Yeah.
like pretty average, but it was an emergency. They couldn't find it
so
for
it
a
was
long
messy.
time. It was messy. It was super inflamed, like borderline
Yeah.
rupture. They got it out, and it just like that's when all my gut stuff got really
Is that
bad.
true?
Yeah, because my ileocecal valve, and
Yep,
I
yep,
am
yep.
a person that has never tested positive for SIBO, which is crazy.
They removed your IC valve?
No.
It just scarred up.
It just scarred up.
Yep, that makes sense.
But I spent decades bloated like I was very, very pregnant.
Yeah.
No one could figure out why. And it, fast forward to prokinetics and some really good ones out
Spoiler
there.
alert.
Yeah. That really helped because it was sort of like a motility thing that happened on top of
makes
scar
perfect
tissue.
sense.
Yeah.
Yep.
So mechanical and
Yep.
a bunch of other things. But
Yep.
anyway, so gas can't get out. We're thinking adhesions. I also really think about lack of vagal tone here.
Yeah.
For
Okay,
people,
talk us through that.
gut brain axis, they're just like
that
their
a thing?
vagal tone is low. Yes, that is a thing. Their brain and their guts aren't communicating properly.
Right,
Things
right.
just aren't moving, and whether that's because of stress or lack of tone for whatever reason, or coming strictly from the gut. I think if we can get people doing the weirdo things like humming and chanting and gargling and whatever 4-7-8 breathing,
Okay. Have you seen that do anything?
4-7-8 breathing for sure.
4,
But-
7, 8, 4 in, 7 hold, 8 out.
Because it loosens the diaphragm, so it's a little bit structural, and it works on the vagus nerve because it's loosening the diaphragm.
And that's something different than box breathing. 4,
Yes,
4, 4, 4.
yes, because the holding the 7 at the top of the inhale is what expands, like causes that diaphragm to expand. I notice it when I'm doing hands-on work with people, and their diaphragm is so stuck and they're so bloated, like nothing's moving
So
in there.
you'll have them 4, 7, 8 breathe.
I'll get them in as much as I can to move their diaphragm down, but if I can have them be expanding, and it's almost like a palate expander they're doing on their own to just remind their diaphragm it can move again, like that full range of motion. Because when your diaphragm is in its full range of motion, it moves the contents of the abdomen. It circulates our hormones better, like our intestines move better. Just no one does that. We all just run around locked up, not
Shallow breathing.
Yeah.
Yeah.
So I get a lot more traction in moving the diaphragm with the 4-7-8. If they can't because their diaphragm is so locked, I have them start with box breathing.
Huh.
and then move to the 4-7-9. And it shifts you very quickly into a parasympathetic nervous state, which is also great for the gut. So I see it work pretty well. I learned
I like
it
to
from
stay tense and hypoventilate while I'm at work for 10 to 12 hours.
Same. And then
straight.
surprise, I'm bloated.
Yeah, I hear that's great for you.
Yeah, that's awesome. Yeah, I think it was Dr. Leela Altman who mentioned that. And I was like, oh, this seems really good for the small bowel. And I found it to be really true. So, yep, shout out to her. Okay.
Breathing, I know.
The other thing that's sort of in line with this gas can't get out is, especially in females, not letting your belly expand. So we've all been taught since like infancy that women are not supposed to have abdomens. We're supposed to suck it in all the time. And we're supposed to wear really tight pants that restrict it. And of course, contents aren't going to move through the abdomen properly with that. So
yeah, I hate tight pants.
Same. I have spent way too much.
I need a lot of space.
Same. But I mean, we all know that patients will come in with like marks on their bellies to like keep it in and they don't breathe. And I feel some abdomens. I'm like sitting there working on them. I'm like, are you relaxed? Because it's like they're doing sit-ups on the table. And I've got this peaceful music.
Try to wear elastic whenever you can.
Totally.
I mean, you know what I'm thinking is like also a lot of women wear Spanx.
Yeah.
I mean? Like
we're not allowed to
corsets,
have
like-
abdomens.
Yeah.
And of course that affects the flow of things through the tube.
Yep.
Things are restricted.
Yep.
So you're going to get more bloated.
Not a good
So I will
idea.
teach people in office, like anyone with this, but it's predominantly women, to like lean forward, like hang over your counter and imagine yourself with every exhale, your belly sinking farther to the floor, like a cow. Like embrace your inner cow. Just let it hang.
Yep.
Try to like loosen it a little bit more.
Yeah,
'cause-
Dr. Sand and the yogis. Yeah.
It's also over here. Yeah. So I think that's really important. And then let me see here. I think that's about it for that section. So let's get on to histamine.
Wait. I would put, I guess when I'm talking to patients, one of the things that I'm always like, if we unplug the bottom,
Yeah.
will all the gas, like if there's a
For
plug
sure.
on the bottom, if it's a constipation plug,
Yep.
that is sometimes the underlying cause of
For
bloating.
sure.
And sometimes I'll work on that first before
Yep.
we do all of the other functional workup
Almost
for
certainly.
the bloating,
Yeah.
because that's
Right,
you
if you
can't get
have
out.
constipation.
Yeah,
But
I
some
would
people
say-
have a regular bowel movement, then they say they're still bloated even
Exactly.
after.
But I
So
always try to get the bowels evacuated. I tell them, like, if I can save you $400 in testing,
Right.
take some magnesium citrate or whatever you need
See
to
how
get
you
pooping.
feel.
Yeah.
Come back if you're still bloated. We know what to do.
Yes.
Kind of
I'm
thing.
with you. I totally agree. Don't
Yep.
jump in at the test first.
Yeah.
Start some functional stuff. If you've done the functional stuff,
Yep.
testing is a lot more important.
Yeah. So the reason this is I mean, we know this, but basically, if there's stool trapped in the colon, it's going to ferment, which is producing more gas, and that has a chance of going up.
And putrefy.
I thought we discussed you not
know.
saying that anymore on this.
I don't know why it gets you so much. It
Well,
might
and
be-
that's what creates the bad smell.
right.
Totally.
The putrefaction.
I know.
Right.
That's what people are like, my gas smells so bad. I'm like, when was the last time you pooped? You know, you're just like brewing in there.
And I think when I'm doing an abdominal exam, I'm smelling the putrefaction.
I don't know how you
Blah.
can smell. You must have really. I guess I'm wearing a mask usually,
Oh, yeah, I'm not.
but
Smart. But if you are backed up at the end of the tube, it sends a feedback to the rest of the tube, the whole rest of the digestive
Yep.
tube, to slow down.
Yep.
So you're shooting in yourself in the foot like double time
Yeah.
with that one. You just have to get it evacuated and then come back and see me if that didn't work. But
Yep.
that's huge. So
you just have them load up on mag citrate usually capsules.
whatever. We have our pharmaceuticals. We have magnesium citrate. Sometimes psyllium husk does
I
the trick.
hear we have a crazy good episode on constipation.
What are you
pharmaceutical
guys
constipation.
dosing?
Yeah,
So
travelers goes with-
do you guys ever? What's your dosing for polyethylene glycol and or senna?
Blah.
Just for a couple days if you're trying to
Okay.
evacuate twice a day.
So-
2 caps twice a day.
Polyethanol glycol.
Because I just had, there was a guy in the
Polyethylene
ER,
glycol.
and they gave him 2 caps twice a day,
Of
and then had
polyethanol
him
or Miralax.
and then had him take senna for a couple days
Yeah.
too. And I thought that's a good combination just for a couple days.
Yeah, because it's senna's dependency
osmotic.
causing.
Right. So we didn't want to do
Senna's
that.
a stimulant.
Right, but the
Miralax is
polyethylene glycol
osmotic, just like magnesium citrate.
Right.
Yeah.
So 2 caps BI. I thought that was a good way to just like try to get some acute evacuation.
I mean, I will titrate up. There are some people that you can use all of the standard tools and they're very effective. There are some people where it's so severe you have to do colonoscopy prep or even double colonoscopy prep.
Totally.
To
Like
get them to evacuate.
liquid, the prescription.
Yes, the
Yeah.
prescription, like the Go Lightly.
I was
Oh,
prescribed
God.
that back in the day.
I mean, it's just
Okay.
like I had a patient right now who has sinusitis, and she got I think 4 rounds of antibiotics. She had
Yeah.
pneumonia and then sinusitis. she has
Can't go.
stopped pooping.
Okay.
She has stopped, and it's at this point, it's like it's frightening.
Yeah.
So you prescribed lightly?
I started with basically Senna, I started
what
with Senna
Miralax
and
dosing?
lactulose. I started with Senna and lactulose.
Okay, you prefer lactulose to
It's
polyethylene.
cheap,
Okay.
I don't know why. I'm having.
Okay.
I think lactulose can do some benefit for the
You can
microbiome.
titrate it too. So
She stalled out. She didn't get anywhere. I sent her to the gastro. Oh, and then I started her on lubiprostone,
Yeah, I was gonna
which is
ask.
Amitesia, right?
Yeah.
I started on that, but the gastro was like, I need you moving first, and she had moved in like 15 days.
Oh
You
my
didn't
gosh.
use Linzess, linaclotide?
You know why I didn't use Linzess?
They don't cover it anymore.
Because lubiprostone just went generic,
I
and
know.
you can get it very cheaply
Same
through
with
Mark Cubic.
Motegrity. It's still expensive though.
I don't know how much Motegrity, but lubiprostone
200 a month
is
for most people.
I mean, that's great.
I mean, it's better than Motegrity, but 200 a month is still a lot of money for a lot of folks.
Lubiprostone's 35.
I know.
And
A
I
month?
think that's 35 for
For
a
the generic.
20.
And
I think that's 35 for 60
lubiprostone,
pills of 24 milligrams.
Yeah,
quick
It is.
reminder,
It is.
how does that one work?
It's a chloride channel antagonist.
Okay, it's not the one that's like the toxin.
It's not the
can't-
cyclophosphamide.
Guanylate- forget.
Guanylate cyclase.
You guys have it memorized.
Is linaclotide, I'm pretty sure.
Yes, I thought
Okay.
it was cyclogenous G receptor agonist.
Chloride.
Chloride
receptor.
is lubiprostone.
I'm pretty
So
sure.
she was
I'm
probably
pretty sure.
impacted.
Might have it backwards.
at this point.
She was impacted at this point.
Okay.
Yes. And so he didn't want to start her on lubiprostone
Sure.
acutely because he needed her to move. She needed double prep.
because she could have ruptured or something. If you probably need a suppository.
Yeah.
She was doing suppositories.
And
Enema?
nothing?
Double colonoscopy prep.
Oh my gosh.
And I'm thinking
so
about it
you're
now.
still going in from above even when she's that backed up.
You
Okay.
wouldn't do like a fleet enema?
She did enema.
She did everything.
She did saline enema. She did fleet. I mean, guys, it was scary.
Yeah.
And I'm thinking about it now. I was just
so
yesterday
uncomfortable.
listening because you guys, as you know, I have no hobbies outside of naturopathic gastroenterology.
So
in my free time,
You have
I'm
a dog?
Saturday night.
You have a
I have
dog?
and I have some kids. I was listening to
floating
this
out there.
phenomenal podcast interview with one of my favorite docs, Mona Mornstein.
Oh yeah.
she's
She's
retiring
funny.
eventually.
She's
Super
retiring?
smart.
Oh no.
She's so smart.
She's
It makes
so
me
good.
so sad. She's so good.
I have to get your diabetes notes.
Oh my
Anyway.
god, her diabetes lectures are amazing.
On another note, to work on
She
my
was
insulin
being interviewed by
prescribing.
Dr. Ruscio, and she was like, every single patient that I have that is that constipated, fungus. And I'm like, fungus.
I mean, she was just
see that a
on
lot.
2 weeks of antibiotics. You said,
She was
right?
on 4 weeks of antibiotics.
For sinusitis.
For first it was pneumonia, and they got the first antibiotic wrong, so I had to double it,
Yeah.
and then it was the sinusitis. And so I'm like, yes.
Yeah,
Why did I
yeah,
not
yeah.
immediately start her on antifungals?
Well, I mean, you don't know acutely. First, you're just trying to get something going. But I've always been
Yeah.
afraid to give more oral when they're that backed up.
Yeah.
But
I think that's what the gastro was saying.
But but even the colonoscopy
yeah.
prep, they were good with that. That's what they recommended.
Double.
Okay,
A
good to
double.
know. I mean, good
Oh,
to know.
that's so
Yeah.
brutal. That poor person.
That's so.
But
yeah.
if it works, because I always thought if
Because
they're
what
that,
would you do? Like, enemas aren't working, then you're like colonics?
I would always try. Yeah, I don't know, because you'd always try the suppository
Yeah.
route if they're that backed up to
Right.
avoid a potential.
Rupture.
Yeah.
Yeah, so
but-
suppositories did not work. Enemas did not
That's
work.
bananas.
Water enemas, warm water enemas, salt enemas, or fleet enemas did not work.
Okay.
Yeah.
She'd get like,
And they
Bristol
didn't
one.
want to start the lubiprostone because they were worried about rupture if they just started
Right.
something orally.
Yes.
Okay.
I mean, those things move, so that's fair.
So that patient, anytime she's on antibiotics, you should have her on an antifungal or at least an herbal antifungal.
Yeah, I mean,
From
she's
now on.
also
In
elderly.
general?
Oh,
she's a
so it's
senior
hard to-
citizen, and so it's tricky because also they don't move as much.
Yeah.
She wasn't on any opioids.
No, absolutely
For
not.
anything.
No, absolutely
Just
not.
the
She just took
antibiotics.
4 rounds of antibiotics.
I
She
just had a patient too,
So much.
antibiotics and then backed up like after the hospitalization and like. Yeah, it's hard to get
Not
things.
moving.
Luckily, it
What did you
was
do?
only 4 days, so I wasn't really worried
So
about.
you did Senna and Miralax.
I did Miralax, and I did. I think I did. He was doing some Senna randomly. I said just do the Miralax, the standard, and I gave him a titration. And then I was like, if that's still not doing it, then add the Senna because I like that.
Yeah.
ER doctor's protocol. Just do
Yeah.
it for a couple days if you need something stimulant
And
too.
it's 800 milligrams Senna twice a day.
I don't remember. It's no, it's not 800. Isn't it like 8.6 or? We probably have different units.
Yeah.
Whatever the dosing is allowed. I don't go above
yeah, I
the
think
maximum,
you're
but
right.
it can go up to I think 2 twice a day
And
or
you're
something.
doing it like 3 days?
Just a couple 48 hours of Senna, I
great.
think. Yeah. So it's not going to create a problem in 2 days.
I don't give straight Senna. I mean, people will do it themselves or do it in the teas, which I like because it comes with the water. But I'm usually doing like the turkey rhubarb, whole leaf aloe, like the combo products because they usually have
Whole leaf aloe. I've never heard that one.
whole leaf aloe.
Whole leaf aloe. I've heard of that.
I did kind of just like.
I've heard of that. I thought you said
Whole leaf aloe. What is this herb? I've never heard of it.
whole leaf aloe. Yeah. Whole leaf aloe.
Okay,
Because
yeah.
you know
Combo
it's like
product.
more exactly.
Okay.
Yeah, and I find it a little bit because Senna can hurt.
Yes.
Like that cramping can hurt.
Yes.
Oh, I haven't told. I mean, Dulcolax gives people cramps,
Any
but I haven't
stimulant.
heard of Senna giving people pain.
Yes, for sure.
Okay.
And it goes quick.
Yeah. So I don't know.
Okay, so it can't get out. We've managed to bring this back to constipation because we're
Yep.
us. Go on
Oh,
next.
the last thing on can't get out is pelvic floor tension.
Yes.
So whether it's like outlet dysfunction, constipation, or whatever, but the thing to remember that helps me a lot is your pelvic floor is mirrored in your diaphragm. They're like, bookends to your intestines.
I love that.
Yeah.
Dr. Sand, you are on today.
So I do a lot of belly work. So if people have pelvic floor dysfunction, like ask about urinary incontinence, like history of carrying a pregnancy, like any history of that, childbirth, chronic bloating, chronic constipation, like things putting pressure on the pelvic bowl, it's going to mirror up above as well. So have
Interesting.
What do
that
you
on your
mean?
mind.
Like if that's weak, then because you're saying if they have tight.
Too tight. Yeah. If it's just imbalanced, I see it reflect in the diaphragm. And now I'm seeing more and more pelvic floor PTs start with the diaphragm, no matter what. Like even if people are coming in for urinary incontinence, they're getting people breathing first.
And incontinence, we typically are having people do like strengthening exercises, but you're saying it's probably tight. Like all other issues in the body, it can be tight or weak.
I think that's a mistake to do that. I don't know that it's just you're too tight or you're too weak. I think it's an imbalance. So if like you had a baby and, the baby carried predominantly on the left side, you're going to
gotcha.
be hypertonic
Okay.
on one side and lax on the other.
Yeah.
So that's, a good pelvic floor PT will do that internal exam and figure out where it's uneven.
Yeah.
And tone that. Just doing Kegels for a lot of people can make things worse.
Yeah, that makes, especially if to be honest.
Because then they're tightening more.
Exactly.
Yeah.
And a lot of
they're
people
already
can't
hypertonic.
relax.
Yeah.
We can all tense up because that's all we do.
Yeah.
But a lot of people can't fully relax,
I mean, like that mirror image of the diaphragm and the pelvic floor, I have never thought about before.
Bookends.
The
Good
PTs
Lord.
talk about that. So you're saying basically if one's hypertonic, the diaphragm will be hypertonic
Well,
too?
so back to like chronic bloating here. It's intra-abdominal.
Screen. Let's show everybody. Yeah.
Chronic bloating. It's intra-abdominal pressure.
Yeah.
So it has to go somewhere. It's
Yeah.
going to go out for a lot of people because that's like the least resistance, but it's also for sure going to push up and down.
Totally.
So they both lock in response to kind of protect you. It's like that guarding kind of concept. Same with your back tension. Ribs go out for people. But like think of the whole cavity in there.
Yeah.
And I do think there are studies, I remember reading about them, about how your diaphragm, tightens and gets harder to relax when you have chronic bloating, which makes sense.
What are
That makes
your
sense.
tools to relax the diaphragm besides the 4-7-8 breathing, which I've never heard about and I love?
Yeah,
What are the tools?
I
you
really
have?
do see that work. People just
Okay.
have to do it, and you have to train people, like rope it into something you're already doing, like brushing your teeth, or
Washing
I find
Eating a meal.
getting into your car before you start driving. I see work really well for people. Yeah, whatever or people are already doing.
Before you gulp down your lunch.
That's right.
Yeah,
Eat too
just take a
fast and get
second.
bloated.
Before you drink your lunch.
Yeah, I think any kind of like mechanical body work that your body is responding to. So I would include acupuncture in that. But like you want to think of it from two angles, like actually physically moving stuff in there, getting things to release and whatever. If people respond to massages or like whatever, vacations, do it. But the other thing is the gut-brain connection. So getting people into a parasympathetic state so their body can actually have a shot at relaxing.
When you are doing manual work,
Yeah.
what happens?
So when I'm doing body work on people, and I'm trained in my abdominal therapy, visceral manipulation, craniosacral therapy, I did a bunch of hands-on kind of therapies. And of course, I mix them for the body that's in front of me. But one of the first things I assess is just the diaphragm and how tight it is. Like, can I move the stomach? Can I move the diaphragm? Can I even feel the difference between the small intestine and large intestine in there? And if I can't, like, is it a muscle layer that they're just holding so much tension? Is their diaphragm so restricted? I'll also put my hands on their ribs and ask them to take a deep breath out. So like lateral, because we all learn to kind of breathe into our bellies, but our diaphragm's connected all around. So I'll have them try to breathe outward or even into their like thoracic. I'll put my fingers there. And if people do that and they have that like jerky breath with it, it's foreign to their body. If it's smooth, they're used to it. But if their body kind of like jerks while they're doing it, it's foreign to their body. So then I'm like, I have them notice that. Oh, did you feel that?
Yeah.
And then I have them like repeat that as much as they can at home to get it more comfortable moving.
Huh.
And then I do a lot of just pulling the diaphragm down, separating the stomach out.
Is there anything that they can do by themselves at home besides the 4-7-8 breathing?
I teach people how to do their own stuff.
Okay.
Relaxing your abdomen, like I was saying, you can get into that, it's called like psoas hammock pose or whatever, where you kind of like lie on the floor and get your knees up, 90-90 onto something, because that makes your psoas muscles, which definitely all of us have way too tight, relaxed in like a hammock position. Because when we're sitting, they're flexed.
Okay.
When we're lying down, they're stretched. They're never really in a relaxed pose, but that does wonders for pelvic tension as well.
And diaphragm tension because of because they're all related.
Yeah, but like see where the root of their tension is. If their TFLs are really tight, or like one hip is really tight, or they're holding, like just mechanically what's off for them. Scoliosis I've seen be another one that really causes issues with the diaphragm.
That makes, again, postural.
Yep.
Yeah.
So, yeah. So those are kind of the first two of like gas can't get in, or gas in, gas out.
Okay.
Any other final thoughts on those?
No, that was great.
That was great.
Okay.
Yeah.
Great. Thanks, Turds.
Thanks, Turds.
Thanks.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.